Ontario's healthcare system has come under fire recently, and tonight another story that highlights its failures. How could an 81-year-old stroke victim be left on a cot in the emergency room hallway for 32 hours?
When you walk through emergency, there's an emergency section, and then after that there's a long hallway. Along one side of the wall there are stretchers. They call it overflow, so there's numbers on the walls saying overflow 1, 2, 3, etc.
81-year-old Philomena Zita was rushed to Mississauga's Trillium Hospital on Wednesday morning after suffering a stroke at home.
She then was placed on a stretcher in the hallway of emergency up against a wall.
And that's where she stayed for some 32 hours in full view of everyone in the ER, the lights on all night, sharing a bathroom with the entire department.
She had a hospital gown tucked under her head as a pillow. So I asked the nurse if we could have a pillow and an extra blanket because she was cold, and they had no pillows, not even, and they had one blanket left for the entire emergency.
The family says there were other patients on those overflow stretchers as well, having been admitted to a hospital that had no beds.
The lady next to my grandmother did suffer a stroke as well, and I believe her son was there with her, and he was even offering to pay to get her mom a room, any kind of room. He didn't care how much it cost.
Philomena's family complained to nurses, patient relations, called the bed management line.
All they could do was apologize.
Did they say this is normal? This is
our healthcare system, yes. This is what they're faced with every day.
That's what they told you?
Yes. They have patients in the hallway every day. The overflow is they don't have enough room for the people that are coming in.
We contacted Trillium Health, who told us in a statement, due to unprecedented demand for service, patients may be experiencing longer wait times for services, and we apologize for this. They go on to say, we are working inside our hospital and with the provincial government on better ways to meet the growing needs of our community.
I was sitting there thinking that I'm in a third world country. Like, this cannot be Canada. I was shocked. I did not expect this kind of care from where we live.
Your grandma's 81 years old, and your sense is here this woman has paid her entire life into a system that now isn't there for her.
She has paid into the system her entire life, and now she needs the care the most, and it's not there. Philomena's family say that the doctors and the nurses did all they could given the circumstances. I did have other questions for the hospital. How many people on any given night don't have a bed, and how long on average do they have to wait for one? The hospital did not respond to those questions. Philomena's family was so concerned about the state of healthcare that they reached out to us to share their story. If you have a story you want told, contact us by phone, email, or through our website, citynews.ca. I'm Avery Haynes, City News.